seen the multiple cases of the women who have died in red states because they're not able to get the healthcare that they need? They're left bleeding out to death. They're left dying of sepsis. Have you not seen any of those? All of those cases are just the doctors not doing their job right, because every law states that in the event that the mother's life is at risk, they can provide abortion care. But what exactly does that mean? Who's determining at what point a woman's life is at risk? Is it when she walks in the door and she's having some bleeding but her vital signs are stable? Is it when her hemoglobin drops to 9, 7, 4? Is it when she becomes tachycardic? Or do we have to wait until she's hypotensive? Do we have to wait until we see signs of sepsis to say that her life is at risk? Or as a physician, can I say, I know that this could lead to sepsis, therefore her life is at risk? Will the court agree to that? Or are they going to say, well, she was clinically stable at that time. Her temperature was normal, her heart rate was normal, her blood pressure was normal. So we don't believe that her life was at risk. So what is that point? And who's going to determine it? Because those same laws that say that physicians who provide abortion care or even give their patients any information about where they can go to get an abortion can be criminally prosecuted, can go to life in prison, except in the event that the mother's life is at risk, has no parameters in there anywhere about what that means. I would argue that any pregnant woman's life is at risk, because when you are pregnant, your life is automatically at risk. But does the court agree with that? So until the law can specify exactly what the parameters are that classify the mother as a risk to her life, giving the physician the exact criteria to go off of, the physician in the state is always at risk. And they have no choice right now but to wait until there's absolutely no question of risk to the mother's life. And at that point, it's too late. Do you understand how this is a lot more complicated than you're making it out to be? I guess I never really thought that deeply into it. No, you guys never do.